you have to ask yourself is, have you been on pain medicines for a long, long time prior to your surgery? And the reason why that's important is because over time, our body gets used to pain medicine. As a matter of fact, if you've been on medicines like Percocet, Lorcet, fentanyl patches, oxycodone, Dilaudid, if you've been on those medicines prior to having a major surgery, it's going to be very difficult for you to overcome the post-operative pain from the surgery itself. The reason why is over time your body gets used to those medicines. It's about like a person who drinks alcohol. If at age 21 you go out and you get your first drink, with one drink you're probably feeling a little bit buzzed. 45-year-old guy who drinks a six-pack every weekend or every other night, it takes more of the substance to give him the same effect because your body is used to the medicine. The same thing happens with medicines that we call opioids. Percocet, hydrocodone, Lorcet, Dilaudid, all of those medicines cause permanent changes to the way your body perceives pain. And so if you've been on those medicines for a very long time, it's going to take longer for you to recover. It's going to take longer for the pain to go away. You're going to need higher doses of pain medicine immediately after surgery. Okay, so that's one thing to consider. The next thing to consider is how much do you weigh? All right, we know this from medical studies. So when you look at heavy patients that have knee replacement in a prospective randomized controlled trial, and you compare them to less heavy patients, the less heavy patients have less pain and they do better and they recover faster after surgery. So when your doctor says, I want you to lose weight, it'll help you, might eliminate your arthritis pain, he's not saying he's not necessarily going to do surgery. He's saying that whether you have surgery or not, you're going to have less pain if you're able to lose some weight. Also, the knee and most other joints in the body function as a lever. Across levers, you generate a tremendous amount of force. And so 1 pound, 2 pounds, 5 pounds makes a big difference because that force is magnified by the lever action of every joint in the body. The knee, the hip have large levers, but every joint in the body functions like a lever. Okay? And then the last question, how severe was your disease? Someone with severe arthritic changes, you get a good joint replacement in place, they're going to have a very noticeable difference in their pain relief. They're going to have significant improvement, and they'll notice that improvement much sooner than someone who only had mild arthritic disease. Acute surgical pain usually goes away in 2 to 4 weeks. That's the period of time when almost everyone is going to need to take opioid pain relievers. Percocet, Lorcet, hydrocodone, oxycodone, things like that. Beyond that, you're still going to have some soft tissue pain. Your joints will feel warm, red, and swollen. After knee replacement, your knee is going to feel warm, it's going to look red, it's going to be swollen for about 2 to 3 months. Okay? And if it's not 2 to 3 months, you're lucky. Okay? But that's about normal. And then stiffness and soreness, usually 3 to 6 months, gradually subsides, and you know your full result somewhere between 12 and 18 months after your surgery.